Hello, everyone. Thank you for joining us for our next LMCH webinar, Needs Assessment webinar. We're really excited to have you again today and to take a little pause in our process to answer any questions that you have and to go over some questions that we've received. So just as a reminder, before we get started, please remember to put your phones on mute and remember to not put your phones on hold, because hold leads us to hear the lovely music that you have in the background, and there's nothing we can do to stop it if we hear it. So if you could please remember not to put your phone on hold, that would be great. So with that, I think we're going to dive right in. I'm joined in the room today by Carrie Terry, Trudy Esch, Robin Osborne, Lauren Peen, and Erin Madden. And we're, again, really happy to be with you today and really happy to have the opportunity to spend time addressing questions and hear from you about how this process is unfolding for you. So more specifically today, our agenda will include kind of an overview, again, of the needs assessment process and timeline, more intimately into the SharePoint site to kind of point out some of the resources that are available there in case you haven't had an opportunity yet to check that out. We're going to talk a little bit about the relationship between this process and your LMCH work plan and timeline, and we're going to go over some additional notes driven by questions that have come forward to us. And we'll have a good amount of time for just an open Q&A session for you to bring forward any questions that you have about the process, anything that we can help you with, and then we'll talk about next steps. I want to jump in and share a little bit about sort of the impetus for pausing in our process for a minute here and doing a Q&A session.
I'd be happy to. I received an email from the chair of the Nurse Administrators Forum, and there were some concerns that were brought up in their March meeting. And so Joanne reached out to me as a local maternal child health program person and asked me to forward their concerns to our MCH assessment group. And so I did forward the concerns, and we thought that it was really important to pause, make sure that we heard your concerns, made sure that we answered whatever questions you had, because we want to make the needs assessment process be really good on your end as well as good on our end, and so we wanted to make sure that there was not any confusion or frustration, or if there is frustration, that we can address it. So some of the things that they asked us to do were to post our slides in advance, to give a summary of activities that needed to be completed for each section, to have a sample final product distributed. And I'm sorry that we don't actually, nobody's completed the whole process, so unfortunately we probably won't be able to do that particular component. They asked us to clarify how the 2019 needs assessment fits into the MCH block grant reporting, clarify what's involved in each section, when each section is due, and provide more reasonable due dates for submission. So these were the concerns that were brought forward to us, and we thought that there were a number of valid concerns that were there, so we thought it would be a good opportunity to pause and really spend this time addressing those concerns. So please make sure if we didn't understand something that you wanted as we press forward that you let us know what that is so that we can work together to make this be really productive for everyone.
Trudy. So again, this is a Q&A session, so I just encourage you to please raise your questions as we go or at the end, whatever makes the most sense to you, and make sure that your questions are answered today. So we're going to start with an overview of each step of the needs assessment process and provide clarity around the deadlines for each of the steps. So you've seen each of our presentations. We have an 8-step process that begins with organizing for success, engaging community partners, and visioning. Next steps in the process, where you are right now, involve gathering and interpreting assessment data. You'll use that data to identify strategic issues around maternal child health for your community. Once you select your strategic issues that you want to focus on, you'll develop some goals and objectives around those issues, and based on the goals and objectives you set, you'll develop strategies and action plans. So more detail, The first step is one that most of you have completed. The intent of this step is to identify an existing group of system partners, MCH system partners, or identify the need to build a group from scratch, to identify a leadership team that will coordinate this process, and to identify how community members most impacted by the root causes of inequity will be authentically involved in the process, to develop a timeline, and to identify barriers or strengths that will support or inhibit the process. This step was due on February 6th, and the large majority of you have completed this step, turned in documentation of that, and are right now receiving some feedback. Step 2 is engaging community partners, and in this step you identify participants or build from an existing group. This includes traditional and non-traditional partners. You identified individuals who are impacted by the root causes of health inequity and put in place supports to make sure that their engagement in the process is authentic. And you invited partners to engage in the process. And again, this step was due on February 6th, and most of you completed it. The third step is visioning. And at this point in the process, you developed your vision and values, creating common ground to return to throughout the process, and shared expectations about how the group will work together. And this step was also due on February 6th, and most of you have completed it. So we're going to try to go back and forth today between giving that overview of the steps and sort of how they are reflected in the actual tool that you submit. So in the LMCH tool for steps 1 through 3, these are the questions that you saw on the slide that would be completed, and we're going to look at the tool itself so you can see it in text. So provided the first part of the tool, where it says step 1, organize for success. In this part of the tool, you answered questions 1 through 4 that you can see on this page. You also filled out the first 4 tables. Timeline. That being the barriers, the third being the strengths, and the fourth being the partners. You answered questions 5 through 7. A little bit more about how you engage partners. You filled table 5, which where you documented your conversation about developing a vision and value statement, and then you filled out questions 8 through 9. And we'll do this with each of the sections. I know you're really familiar with these sections because most of you have completed them, so we'll go through the others a little bit more slowly, but just to kind of give you that reminder of the relationship between what we're talking through in the slides and what you're actually turning in, or what you turned in back in February. So that's the first 3 steps of the process. Most of you have completed those steps and provided your documentation. And are receiving feedback at this point. So step 4 is the assessments, and there's actually 3 different assessments that we are providing training and support around. The first assessment that we talked about was the community themes and strengths assessment, and this assessment's really focused on learning what MCH looks like from the perspective of community members, and that can be done in a variety of different ways. Some of you are using photo voice, some of you are using surveys, some of you are using community input walls, some of you are holding community forums. This can just be done in a whole wide variety of ways based on sort of the capacity that you have, what you think would be meaningful and helpful. The second is the maternal and child health status assessment. And this assessment involves reviewing some key metrics that reflect health status across the life course, as well as the determinants of health across the life course. And so we're in the process now of sending you data books and other data resources that you can use to review and to learn about health status within your community. The third assessment that we plan to provide an orientation to today, but we've held a couple weeks on this, and this has been rescheduled, is the Maternal and Child Health Status System Assessment. And through this assessment, you'll sit with your community partners and discuss how MCH services are delivered within the community to find kind of those system gaps you may or may not have within your MCH system, within your community. So this step 4, is due on June 23rd. You submit all of the assessments at one time. You can also submit them as you complete them if you'd like to get feedback. If you'd like to get feedback earlier, you'd like to get preliminary feedback, or you'd like us to just have them with a little bit more time to review, you can submit them at any point in time, but they're due on June 23rd. Step 5, also due on June 23rd, involves bring together your partners to interpret your assessment data. So we'll have get all this information and looked at it, but you also have to make sense of it and decide what it means and what points you want to pull out of it. That's what step 5 is all about, summarizing your key findings found in each assessment. And the way that we've set it up and recommend you work through this is after you gather the assessment data, so after you do your focus groups or after you do your intercept surveys or whatever you decide to do, you'd bring your partners together and look at the results just as soon as you've completed data collection to keep those two pieces following each other closely. It's really the most efficient way to approach it. So again, this step 5, for each of the assessments is also due on June 23rd. And again, you can submit those early if you would like to, if you'd like to do so. So we are in the process right now. We've completed orientation to community themes and strengths and orientation to the maternal child health status assessment, but you haven't yet received an orientation to the maternal child health system assessment. So right now you're gathering your assessment information and interpreting your assessment data. So just a note on what we're doing right now. We are in the process of emailing each health department a feedback form for steps 1 through 3 and a data workbook for the MCH status assessment. The way we've done this is that health departments that have completed steps 1 through 3 are receiving their data workbook first. And we also want to highlight that each health department is receiving 2 workbooks as well as supplemental data. There's a workbook with state-level data and a workbook with data for your health department. And some supplemental data sources that didn't make sense to really include in those workbooks, but will provide helpful information. One more note on this feedback form. The intent of that feedback form is to just provide some ideas about how, if you were to go through this process again, or if you were engaging in this process for another purpose in the future, the things that you might want to consider and think about, or even as you go through this process, things you might want to consider and think about. In some cases, a health department may not have completed their vision statement yet before they submitted, which is totally fine. In those cases in the feedback form, you'll see us encouraging you to submit that vision statement when you submit materials in. However, largely the feedback within those feedback forms is really just that. It's feedback. It's not saying you have to do something differently or you have to change something. It's just to give some ideas, some food for thought, some things to reflect on continuing on this assessment process or engaging in another assessment process. It's also intended to provide information about the really great things that you did during steps 1, 2, and 3. We noticed so many things that were worth celebrating and wanted to make sure that those were articulated in the form too. So you'll see a lot of notes about your successes when you see those feedback forms. Okay, so we're going to jump back to the LMCH tool so that you can see where you're going to input information after you complete each of the assessments. So you see in the tool, steps 4 and 5 are together, and this section of the tool starts with just some background on the purpose of the assessments, what each assessment includes, and some sources for data. A lot of these sources are reflected in the spreadsheets that you'll receive, but it's kind of good to know what's out there and to have those on hand to websites, like information about IRBS, for example, it's good to know, how you can get that state level information on maybe other questions where you've seen it in the MPHI and you're wondering if you can get it out of the IRBS to have that state level comparison. It's good to have those kinds of resources and be aware of them. The first section of this actually talks about the health status assessment, and you're asked to answer a couple of questions. What process did you use to get your data for each measure? What resources did you use? What data gaps did you encounter? And how will you address gaps in your data? And so within each of these sections, we're just looking for a paragraph where you're kind of describing the process that you went through, as well as what you noticed about gaps in particular. I think that in communicating to state partners, it's really great to know at the local level where gaps that are important to you in your community. Then in Table 7, you will summarize your key findings. So under the findings column, you'll create sort of a bulleted list of the things that stuck out to you as you reviewed all of those measures. Places where you noticed a disparity, places where you noticed differences between different counties, places where you noticed that you were in a different place than the state is as a whole. So you'll summarize the findings in that first column. In the second column, you'll talk about which phase of the life course is the focus of the finding. And this is helpful because when you complete this table, you want to look across it and see, are there places where we might have gaps in our understanding of health from a life course perspective. Last column, you'll note what data informed the finding. It's surprisingly easy to get to the end of a process and realize, gosh, we said there was this gap in, or this issue around tobacco use, but we're not really sure what indicator we pulled that from. We're looking back and we can't see it. So it's good to make that note right as you're going through this process of which indicator you were looking at in particular when you came up with the finding. The assessment you see in the tool is the community themes and strengths assessment, and there's a bunch of text that kind of goes over what we talked about in the webinar, the sorts of questions that you can answer through this type of assessment and different strategies you can use for answering those questions. There's more resources on each of these strategies on the SharePoint site, and we'll get to that in just a second. The next piece of this is a question that asks you about the methods that you chose to gather community input. So you'll describe, if you did a photo voice project, you'll describe that project. If you did photo voice and a community input wall, you'll describe both of those things. You'll, in that second bullet under B, about the participants that you targeted. This could be a broad community group. Maybe you just focused on adolescents. Maybe you just focused on clients of a particular service that the health department has. So this is where you'll describe who you gathered information from. Then you'll talk about the information gathering tools you used. So you might have used a focus protocol that has these questions, and you'll list out those 5 questions. And you'll describe the process that you used to gather the information. So if you did a focus group, you'll say, we invited 10 community members, 8 came to the focus group. We provided refreshments and an incentive to participate. It was facilitated by so-and-so. It lasted about an hour, that type of information, just so that we have a sense of what that data gathering process looked like, which is also a helpful resource for you to have to turn back to any year from now when you're kind of reflecting on what you did before. It's good to have that documentation of what you did. The next piece is another table where you'll bullet out the main findings from each of the data gathering, community input gathering methods that you used. So in the first blue column, if you did a photo voice project, you would note photo voice project. In the second column, you would bullet out your main findings from that photo voice project. There's 3 built-in bullets, but you probably would end up with more than that. So you would list out each of your findings around opportunities for improving maternal child health, and you'd also bullet out what you learned about community strengths. I think in gathering community input, it's you have both of those things, and it's really important to document both so you know what you have to build on and you know what people really enjoy and appreciate about your community as part of this process. So the assessment we haven't oriented you to yet, so you haven't received this piece of the tool. This piece of the tool, we have question 14, where you'll talk about the process you use to complete the system assessment. What this will look like is bringing together your community partners around each of the essential services and having a discussion about, we have sort of guided protocol for having a discussion where you'll talk about different things that you do, gaps and things that you do sort of at the system level and the services that you provide around maternal child health. And when you're completing the tool, you'll talk about the partners that were a part of that process, how you ensured that there was an open discussion, and the strengths and limitations of your process. A lot of the time when you gather information through a discussion, there can be challenges that come up and lessons learned, and it's good to capture those. Again, the next piece of this interpretation, what you'll do is you'll bullet out your findings related to each of the services. So the first that you'll talk about is assessing and monitoring maternal child health status to identify and address problems. So you talk about opportunities for improving the system as well as system strengths. When we orient you to this assessment, we'll go into then much more detail to kind of describe what each of these are and how we would recommend having a conversation about them. So that is that's the three assessments, and that's really the bulk of the work of this process is in gathering and interpreting that information. And that part of the process is due July 28th. So step six, you'll identify strategic issues. And this step, you'll look across your assessments to identify findings that are related and generate themes. You'll rephrase themes as questions that highlight strategic issues that, if answered, would improve maternal child health, and you'll prioritize strategic issues with your partners. So, again, this is about finding themes in your data and identifying your priorities, and I said the deadline wrong, didn't I? So the deadline for steps 4 and 5 is June 23rd. The deadline for step 6 is July 28th. And
I think we're getting a lot of questions, Julie.
Oh, are we? Okay, let's pause and answer the question.
Let's take the questions maybe about the assessment. I think there were lots.
Awesome. Okay, have a time frame for when we should be expecting the data books. It's been 3 weeks since the first time we were told we were getting them. Yes, we are in the process of sending them out. Some health departments have received them, and some have not received them yet. We can respond to you more specifically about when you'll be receiving yours, to the person who asked that question. We have waiting for some other pieces of data that we hope to add, and we actually have, since we started sending them out, we have received some additional data that could be used as part of this process, and we'll be getting that to you as well. But many of you have received data books, and some of you are still waiting, and we're sorry it's taking us a little bit of time to get those out to you, but we'll respond with when we'll get yours to you. Let's see.
I will also say that what we did just particularly from our end is we decided to send out the data books with the feedback. So the first people that sent in their feedback are the first people that get their data books. And then if you send your feedback in a little bit later, or your steps in a little bit later, our feedback is then a little delayed, and so then you're a little bit more delayed in getting your data books. And we just kind of had to do that logistical way that made sense to put everything together. So that's part of the process, why you may also be delayed.
Thank you. Are those being discussed on the SharePoint website? The way we decided to send out the tool originally was to send out pieces of the tool and to post pieces of the tool on the website versus the tool as a whole. We thought that might be more digestible to get one piece at a time. However, maybe it's causing more confusion, and we're more than willing to hear your feedback on that. If you'd like to have the entire tool, we're open to having that input and providing that if that would be more useful. The intent was, as I said, to make it more digestible, but yes, they're being discussed or they're being posted on the website. step 6. Back over to the tool about submitting step 6. You'll describe the process that you use to identify themes. So this might be, we met with community partners twice. We reviewed these pieces of data in each of these meetings, and we identified the things that stood up to us. And we'll provide guidance, again, suggestions on how to approach this process. But under question 15, you'll describe how you decided to do it. And under 16, you'll describe the partners or community members that played a role in identifying the themes. Then under 10, you'll describe the themes that you identified. You'll note the theme that you identified across findings, and again, you'll note the specific findings that led to that theme. So you might have a theme like, I think there's only an example in here in the text, but you have a theme like, there are few opportunities for lessons to receive behavioral health and mental health services, and you might have had that come up in a focus group. You might have some data that speak to that, and it might have come up when you were discussing service delivery and services within your community. So each of those findings you would want to relate back to that theme. I know this is a little bit confusing at this point in time, but again, when we get closer to this step, we'll dive into sort of a process for doing this systematically. But that information you'll include in that table. Table 11 will identify strategic issues. So typically what happens is there'll be more kind of themes than you can really in your work plan for LMCH or within your department as well. So you have to kind of step through a process of getting from your themes down to your priorities. And the strategic issues is sort of the intermediate point of getting from themes to priorities. And you'll talk more about that when we get there. But again, this is where you'll document the strategic issues that you come up with. And then about the method that you use to set priorities, as well as the 3 to 5 strategic issues that you decide to prioritize. And in Table 12, you talk about each of those strategic issues and why they became priorities for your community. And I'm saying this, but we'll talk more about an approach to doing this when we get to this point in the process. In 7, you'll develop goals and objectives. So at this point, you'll have identified priorities you want to tackle, and for each of those priorities, you'll write a goal and an objective for each goal that indicates what you want to accomplish. And back over to the tool, there's a place in the tool for that. Increase the size of the document on the screen. Mm-hmm. Yes, we can do that. That's helpful for me too. So you can include that information about goals and objectives in this table here, and you'll indicate the issue that you're tackling, the goal that you set, and your objective. And the table is set up to help make sure that you have each component of a SMART objective covered. I forgot to say, this part of the process is due on September 15th. Oh, I did wrong again, didn't I? This part of the process is due on August 11th. I'm flipping my pages. All right, so the last phase of the process is to identify strategies and develop an action plan. And this is the piece of the process that will help with completing your LMCH work plan. as will step 7 to some degree. So under step 8, you'll identify your potential strategies, prioritize strategies, and develop an action plan. And again, within the tool, there are questions and tables to document your work and describe what you did. Due September 15th. So you'll describe the process you used to identify potential strategies. You'll determine what strategies you wanted to prioritize, and you'll indicate if you're pursuing promising strategies that lack an evidence base, and if you're doing so, what you'll do to make sure that it's working as you intended. And Table 14, you'll describe a little bit more about those strategies. Table 15, there's a template for completing an action plan. Again, like I keep saying, we'll talk more about what this looks like when we get to this step. So I think it's important to return to one of those ideas that we really started with at the beginning. We are really encouraging you to build from what you have. We want you to think about how this links to other processes for health assessment that you have in your health department or community. If you've already completed part of this, you don't have to do it again. And if this is really new, or you're at a point in time right now where you have not a lot of time and capacity to focus on this, we're asking you to just tackle what you can, what's feasible. Maybe that means you identify one priority to move forward with around developing strategies and action plan. Maybe that means that when you're doing your assessment, you focus on just the data in the Excel spreadsheet that we send you and not looking at the supplemental materials or gathering additional data. Maybe when we get to the assessment, it means focusing a couple of the services now and then a couple of the services down the road. So there's a whole variety of ways we think that this process can be adjusted and modified to sort of meet where you are and along with the capacity you have to do this right now. However, I totally can see that it could be challenging to think about how to do that, how to focus it in, and how to make it really manageable for where you're at. So if you're having trouble thinking about what would be how it would be okay to focus it, give us on and let us talk with you through it and come up together with a solution that makes sense to you. That's what we're here for, and we're more than happy to help with sort of right-sizing this idea to where you are to make it useful for you and doable.
You know, some people have said that they like the webinar format, and we can easily set up, if you want us to pull some documents so that we can see them when we're talking with you, so we can set up like a mini webinar with your particular agency if you're struggling with things. So really happy to do whatever work to make this move forward with your agency. So please feel free to reach out to us, and we are happy to help in what way works for you.
Thank you. So recap the timeline. Steps 1 through 3 were due on February 6th. Steps 4 and 5 are due June 23rd. 6 is due on July 28th. Step 7 is due on August 11th. Step 8 is due on September 15th, and the final submission is due at the end of December. However, with all of that said, we are more than happy to accommodate requests for deadline extensions. The deadlines were really established only to help the process move along and try to make sure that you're not feeling super crunched at the end of the process to get a bunch done in a really short amount of time. However, we completely understand that things can take longer than you expect. Things can come up, get in the way of meeting a particular deadline. Just stay in communication with us, and we're happy to support you and work out a timeline that makes sense for you and works for you. So pause there and ask. We'll unpause all the lines so you can ask questions out loud, or you can type them in the chat box. We'll see if there's any questions that we can answer at this point in time.
Hi, this is Michelle Klein. So I'm wondering if you can post all of the tools with all of the steps on the SharePoint site so we have those up front.
They're there.
I've only seen what we've already done.
Right. I posted the whole tool all together as one complete document, and that we can do. We posted what we covered. Like I said, we tried to do it so it would be like bite-sized, but we can post the whole thing so you can see the whole thing.
That would be helpful for us planning ahead, yes.
Absolutely, we can do that. Look at it, it brings up a bunch of anxiety, just call us, and we'll kind of chat with you about it in advance of the training. Question about resources for qualitative data analysis, and we are happy to identify some resources and post them on the SharePoint site. We will definitely do that. Thank you, question. We also have a question about the data that were sent by email for the community health status assessment and which are for the health system assessment. Okay, so the data that we sent are actually all for the community health status assessment. There are some system indicators within that data set. However, we're thinking of all, the indicators that are about health outcomes, health behavior, social determinants, the service system as all of that quantitative data is with that health status assessment. The system assessment is a separate assessment that will, if you're familiar with the MPHI, it'll look something like that. It's a simplified, more streamlined idea of how to do that, and it's really more like a discussion guide around each of the essential services. So rather than looking at quantitative data for that assessment, you'll be having a conversation around the essential services. It's around the MCH essential services versus the public health 10 essential services. Overlap substantially, of course.
Hi, Brad Snyder. I have a question.
Yes.
So we did a trial run of our inner survey at some health fairs this past weekend, and there was 3 questions on it, and overwhelmingly we had feedback that they didn't understand the questions and they were at too high of a reading level.
Oh.
I can read off a few of them to you, and I was wondering if you could give me some feedback. The first question was, what are characteristics of your community that promote health across a person's life course? There was, what are important issues that need to be addressed to improve health across the life course? And the question was, what do you think your community is doing to improve maternal and child health? Doing it.
So ways you can actually, if you send us those questions, we will send back ideas for how to answer them in a simpler, or how to ask them in a simpler way. Just in general, a word like characteristics, you can change a word like that to a word like, what are some things about your community that is a good place to live? What are some things about your community that help keep families healthy? Like that, to try to simplify, but we'll take, I started to try to write down the questions and I couldn't keep up. So, but if you send them to Lauren, we'll go through each of the questions and suggest sort of a simplified version of it. There's also a resource that we'll post on the SharePoint site. CDC has a plain language guide, which is awesome. It's a really, really nice resource for public health terms that are not part of the everyday vernacular. So, how do you talk about morbidity and mortality in a way that people can understand? Not that those words were in your question specifically, but they just came to mind. So we'll post as well, that plain language, or a link to that plain language resource, because it's really nice for when you're trying to get across an idea and you're not sure how to say it in a simpler way.
Most people also don't know, for example, what life course means, and so that was in 2 of your questions. It's a really great example, Brad, I'm so glad you brought it up, of some of the technical assistance that we can provide for you. So if you're getting ready to do something like this before you go out to the health fair and you want to just run those questions by us, if you just send them to us, we can make some suggestions so that the process might be smoother as you move forward. So that's a great example of how we can help you out.
Okay, thank you.
Thanks for your question. What other questions you have? Okay, I think we'll move forward and walk through. Oh, did someone?
I just have one question. So my financial officer is here because he thought we were going to talk about financial questions. And I do see that we have some people there that maybe can speak to it, but is that something you're going to address later today, or?
A section that's a little bit about the LMCH work. Maybe that would be a good time to jump in with financial. I'm not sure what the question might be.
But if it's on your mind right now, you can get in. I'll be happy to try to address it for you.
I had him leave because so much of this was not his piece, but we can bring him back in.
Or alternatively, feel free to send us an email, and I'll be happy to answer a question by email, or we can have a phone conference about it off the webinar. You're welcome to bring him back in, too. Just whatever's best for you. What agency is that? I can always follow up, too. I'm sorry, who is that?
Yeah, it's Lenawee County. I know that one of his two big concerns, I think, is one is counting in direct cost, and the other is what it counts as not counting the cost of operating your business. And I know from a couple of webinars, the clinical piece and the financial piece looks at it a different way, so that's problematic. So I mailed a couple of people, and he doesn't feel that he had a good answer.
I don't know if he emailed me about that question. Honestly, I don't know the answer. I would have to defer and get some more information right now. But if he emails, this is Trudy. If you email Trudy, I will do my best to figure out the answer to that and reach out to some other people to help me.
I'm just going to have him do that. I think it's better than probably not a lot of time.
Our auditor or to some people in budget to help me with that question, because I don't know the answer to it, but I will find out the answer.
Okay.
Have an email. Thank you.
Okay, I think we're back. We'll put everyone on mute and jump into walking through the SharePoint site, and Erin's going to do that for us.
The SharePoint site has everything that we have discussed our webinars, everything on the SharePoint. I'm going to give you a little tutorial of where you can find those things, and then at the end of my slides, I'll flip over to the actual website and kind of click through the process so you can see it firsthand. You'll have a copy of the slides on the SharePoint as well, and that's the web address to get there. Just so you can mark that, or however you want to keep a hold of that. All right, this is generally what the SharePoint site looks like. It's broken up into a document section, calendar that has all the dates of the webinars and due dates, and a link section where there's extra information that's just a good resource for you all to have. This is the document section, and here we have where all the tool templates are, and again, that's the tools that you've already completed or we've already discussed in the webinars, but we'll go ahead and post the complete tool for you all to have following this presentation. We also have the webinar presentation slides, and we'll post those a day before each webinar. Now, so today's slides are up there right now if you want to check them out. We have the steps 1 through 3 resources that are in there, and steps 5 community themes and resources. There's also a frequently asked questions document there as well. Under the links section, those are where you'll find all of the webinar recordings if you missed a webinar and want to listen to it in addition to having the slides. There are also some other examples that are web links that you can click on there. All right, flip over, I believe, to the actual website here. So here on the SharePoint site, it's pretty just one page. And like I said, in the document section here, you can click into the full templates, and there's our 3 templates that we've done. Webinar presentation slides. Here, all the slides in today's is right at the top. It says QA webinar. Let's see. Some resources from steps 1 through 3. Here's all of the examples that we talked about: elevator speech, flyer, it's the announcement and invitation letter. Step 4 and 5 resources. Here's where you have the community input wall training guide, the intercept survey training guide, and the sample focus group protocol. On the calendar, if you click into, let's see, today's webinar here, you can find all of the descriptions of the webinar with the call-in number and the access code and the website right there. And if you see the links, like I mentioned, all the web recordings are kind of messy. We've tried to figure out how to make folders, but we're still working on that. Find all of your website link resources in here. And again, contact information, if you click here, that will direct you to the emails or phone numbers. That's all I have.
Thanks. Questions, we'll unmute the phones again. Are there any questions about the SharePoint site? Anything you've been challenged with in accessing information on the site, or anything else you'd like posted there?
Here. Yeah. I do notice though that the hotel
can be a little bit finicky to work with.
which will be full. Registration deadline is March 20th. Sorry, 9th of March.
Okay, I think we'll move forward and talk about the MCH work plan and the LMCH needs assessment and how they work together, starting with kind of the overall purpose of the assessment and the connection with the block grant. So that was one of the questions that we got. Trudy, you want to jump in and talk about this?
Sure. I'll just start by saying that at the federal level, Title V, which is part of the Social Security Act, has been undergoing a transformation at the federal level. And because of the transformation at the federal level, there's a transformation at the state level, and we've passed that transformation down to the local level. And you might know that at the federal level, one of the requirements for the states they have to do is that they have to do a comprehensive needs assessment every 5 years, and they have to do, and we have to do an annual report and an annual application. And we're constantly looking at the assessment of our state and how that fits in into the federal, and we like to get input from our community partners and our stakeholders. So one of the primary purposes about this MCH block grant is to support the local MCH program alignment with the transformation of this Title V block grant that's going on at the federal level. And we have certain things that the block grant looks at from a federal level and a state level. So we have a focus on life course, there's a focus on family engagement, there's a focus on social determinants of health, there's a focus on health equity. So all those things are combined in this MCH needs assessment because they're part of that bigger picture in how we look at maternal child health needs across the life course and how a child's well-being really starts before they're even conceived, and then through pregnancy and their infancy and their early childhood. So that alignment between the assessment activities, the assessment and the activities and measurements that we do in our local MCH plan, we were hoping to strengthen through this MCH assessment. The other thing that's our 5-year needs assessment, one that I think has been a gap for us in the past is that we haven't really understood in an in-depth detail the needs that each local health department has. So now with this opportunity of getting all this wonderful information from you through the submission of your MCH tool, to understand that a lot better and build that into our next 5-year assessment, which we're already planning for. We had our 5-year assessment in 2015, so we're on year 2 of the cycle, and as you turn in your information, that will help us better inform the local needs and our next assessment, which will be in 2015, or I'm sorry, is that right? What did I just say, 2015, 2020. I need to add a little bit better in my head, don't I? So that's really exciting for us to be able to have that true local level input into our next needs assessment. So that's what we want to do about incorporating it into a 5-year needs assessment. When we were talking about this one-time funding, you know, if all the stars were aligned, it would have been just beautiful if we could have taken each step of the MAP process, get it all complete, and then have you work on your fiscal year 18 plan. In fact, that's what we were thinking of. But we really take into consideration, and there's been changes in timeline at the department level as to when they do and when they want things to be put into the e-grams and when the budget allocation process is due. So the bottom line is that for fiscal year 18, the stars are not in alignment. This MPH needs assessment that I'm doing right now, it isn't going to inform fiscal 18 very well. Obviously, your plans, as you got from your notification, the local MPH plans are already due, I guess next week. Next week, they're already due next week. We've actually received a couple of plans, thank you to our early adopters, and we've already approved 2, so woohoo. So that the start really in alignment to use this MPH needs assessment for fiscal year 18. However, they are in alignment that you can start planning for fiscal 19. So for those of you that are long-term planners like myself, this is great news. Those of you who think, oh my God, fiscal 19 is a lot off, that seems crazy, and you really want to use it in fiscal 18, there's still an opportunity to do that in 18 because there's the budget amendment process. So if you like to amend your work plan based on the funds that you're getting with your assessment this year, that's certainly an opportunity that you can do if you desire. You have to do that. If you don't want to do that, you can wait until 19. We're hoping that that's what the MPH needs assessment will help you with, is to figure out, maybe you've always done things a certain way, but as you look at the needs of your community, maybe you missed a gap that you didn't realize before, or either you knew there was a gap, but you weren't sure what to do with it, and so maybe now there's an opportunity to do something different. You know, everybody's different, and that's what's exciting about assessment, because you can kind of see what's going on in your community and figure out how to do things differently. One thing you probably noticed in your local MCH notification is that in the local MCH plan, highlighted in red, where the sections of the plan correlate with the steps of the MCH needs assessment process. That was put in there this year just as an informational session. We weren't expecting you to have those things ready for us next week, but we wanted to be able to kind of plug pieces of the puzzle together so that you would understand, in the perfect world, if stars were aligned, where these things might flow. So you'll see this again when we do our work plan for the next fiscal year. For fiscal 19, we'll put these in, and hopefully you'll be able to use some of your assessment findings that you're covering this year as you do your fiscal 19 plan. As you know, the local departments are asked to do things by performance measures. So you identify a national, state, or a local performance measure, and then your activities are built upon the services of the pyramid of services that MPHI has explained for us. So you either do them by direct services, enabling services, or public health services and structure. We report to the federal government things, these service categories, and that's the reason why we have them separated out by direct services for children, direct services for women, enabling services for children, enabling services for men, and public health services and systems. So our budgets are those 5 different categories. Those categories are the exact same levels in the needs assessment tool as well as then in the work plan. So we're trying to align things so that things make sense as you move forward. So hopefully it makes to you, and if it doesn't, please ask some questions.
So I will pause there and unmute again for any questions that you might have about that piece.
Really? That's good, right?
Deidre, so one of my questions is the expectation that we are going to run an assessment every year. So specifically in our county, we work with the hospital to do a countywide assessment, and actually every group in our organization works with this assessment every 3 years. And then the last 2 years when I give that data, I get feedback that I need more current data, and we don't have more current data. So the intent now that we are going to continue every year to run our own assessment because of our data being 3 years old.
We are internally talking as our LMCH team. As I said, the federal government requires the state to do this comprehensive needs assessment every 5 years. And it's expensive and time-consuming, we know, to do a comprehensive needs assessment on a regular basis. And so talking about, you'll notice in your local MCH plan, in fact, we said if nothing changed on not on the work plan, but on question number 1 and question which is the priorities, and question number 2, which was related to the disparities, and then your justification. If those things hadn't changed, we told you that you didn't need to update those this year. And that's because we're really moving toward thinking about doing these bigger assessments, not annually, but on a maybe every 3-year cycle or a 5-year cycle. So we have some discussion about that right now because we understand how difficult that is. We've been asking in the work plan under the data section if there's any updates on the data, and if there's not, it would be nice if people would just indicate that's only expected every 3 years or every 5 years. But there's some data that is helpful to know that you're moving in a positive trend or plateau or negative trend on the work plan. So, for example, natality data gets an annual update, although there's a lag time on it. So we're trying to work through some of those data issues, but to have an idea how we're moving forward with the data. Does that answer your question?
I would ask,
Thank you.
Carrie, if you're asking us, do we expect you to go through a needs assessment process for the MCH population every year? The answer is no, we don't expect that. But were you asking us, I was also wondering if you were asking us if we're going to provide you with the data from those data books every year? Was that part of your question or no?
No, it wasn't, but you can respond to that since you brought it up, but no, it wasn't.
No. Our response is we don't have a response for that. It was a tremendous amount of work to come up with that data. I don't think we could do it every year. Definitely, I think commit to doing it once every 5 years to coincide with, the needs assessment we'd love for you guys to do at least once every 5 years. Morally, we'd have to work with EPI staff on that because they're the ones that did the logistical work of analyzing that data.
The data, really.
Yeah.
Chris is going to have to add on a little bit there.
So to answer your question, so we're not expecting, sure. I think in the past we actually have said, what is your updated data? And we're realizing how difficult that can be. So we're trying to really see more alignment on how other data, assessment data sources are done, 3 to 5 year basis.
Yeah. Okay, thank you.
Question from a slightly different vantage point. I would say that the thinking around health assessment in general is moving toward thinking of it as an ongoing process where there's these phases, these time points where you do sort of the big refresh, but between those 5-year needs assessments or 3-year needs assessments, there's some ongoing assessment activity that takes place. So what that looks like at the state level right now for the block grant is just kind of picking pieces of things where there's gaps in assessment information, where that's sort of the focus of a particular year. So right now we're gathering more assessment information about how state MCH programs gather input from consumers and families. And so it's not doing a great big huge needs assessment, but it's kind of saying, well, we don't know as much about this as we'd like to. Let's tackle adding to our assessment this little idea or this piece each year. So I mean that from a requirements perspective, but just from a best practices and assessment perspective, is thinking of it as more of an ongoing process. Some points in time where there's a larger sort of comprehensive assessment completed.
That's a great point, Julia, and actually just a reminder to everyone that those ongoing needs assessment activities could be a part of your annual plan. If you wanted to take that perspective and kind of out certain needs assessment activities every year, you could do that and put it under the public health infrastructure.
Yeah, and you could use your Title V low MPH funds to help support that.
I'm not eavesdropping, but are you?
Good. Anything else in the section?
Helping me. I was trying to decide how much I should have taken out, and I don't want to take it out.
We'll put them back on mute, and we'll go through a couple other questions that have been asked. So one of the other questions was around what exactly the submission of the tool would look like, and hopefully receiving the tool in its entirety will be helpful in giving you a clear sense of what you'll be actually submitting and sending back in. The intention is that it's a template where you can capture all the information that you produce through the assessment process. There will be some variability across health departments and specifically what you submit because we aren't asking you to duplicate something that you've already done. So if you have a vision statement that you've already written that guides your MCH work, you would list that vision statement, but you wouldn't have to fill in the table about visioning. So there will be some variations like that from submission to submission, which is totally fine. But in general, the information that you'll provide in the context of that template. Also, several of you have received your first feedback forms. We'll be sending these after you complete and submit each step. And the intention of the feedback forms is to kind of go through the different things that you're being asked for in the tool and provide some specific feedback on what we think is really great about what you did and some opportunities for improvement for next time around, or for if you have the bandwidth to go back and enhance pieces and would like to do that. So these are not, the feedback forms are intended to say you must go back and make these changes, just intended to give you some food for thought and some sort of reflection on what you did from a vantage point. Another request that we got was around posting the webinar slides before the webinar, and we are going to do our very, very best to make this happen. As you know, all of you know, we all around deadlines, and so we're going to back up our deadlines a day and try to get these posted so you can see them before the webinar. And I think that we've covered the questions that we have received directly, and so we're going to open it up for questions, and I already see one coming through on our chat box. So based on the fact that I've received no feedback and submitted by the deadline, you received our work. So we will look into your department and figure where your feedback is, make sure we have what you submitted and figure out the status and get back with you. Thank you for your question.
I'm coming soon, Lisa, because we just MPHI does a review, and then MDHHS does a review, and then we send back our collective review. So we're so interested in what you're doing, so we're we're doing a lot of review here, and then, you know, we make our edits and send it back, and then Lauren's in the process of sending it back. So we have multiple people reviewing it, which is part of the reason why there's a lag time there. So we apologize for that, but we just want you to know that we are so interested in what you're doing and feedback. So that's the reason why I think it should be coming soon, because I remember, I'm pretty sure I have you on my yellowed out list. So, and it should be coming soon.
So we got a question was the question about qualitative data analysis answered, and I gave a very broad response of we will post some resources to the SharePoint site about qualitative analysis. Something you'd like me to speak to here on the call, I'm happy to do that if it would be helpful to get some input right now. Or looking for a resource, something to read, something.
Yeah, that's fine. Perfect. I can't read your writing.
I think we were just looking for a resource. I actually had to step away, so I'm just collecting the answer to give back to her.
Awesome. Yeah, we will. We'll post a resource on SharePoint site or a couple of resources to help with that process.
Thank you.
What other questions are out there?
800. I got to check another 800.
Maybe not questions, but there's some frustrations that you're having that you want to communicate with us so that we can resolve those.
Feeling like something. And so I want, and then she's so overwhelmed with like.
I want you to, somebody is having a conversation outside of this webinar that people can hear, so I hope it's not confidential.
But I knew that if something was wrong, Ashley would know, and she went on and on, so I wanted to know the hospital. Did she said that was something, you know, like, is it because thinking she's getting ready to leave? She's worried about me? Oh, that's like that. No, the hospice nurse did. That's the feeling I've been getting. Oh.
We aren't seeing any questions come through the chat box at the moment, and not hearing questions on the phone. We'll pause again for questions after we say this, but I really do want to encourage you to reach out to us for assistance as you need it. We are more than happy to walk through any concerns that you're having. That's what we're here for, is to help support you through the process. I thought maybe we should play that song, Call Me Maybe, at this point in time. I had that thought this morning when I was getting ready, but didn't execute on it, and I'm not singing it. If anyone would like to on the phone, go ahead, but really, do call us, email us, get in touch with us. We're here to help. We want to ease your frustrations, address your concerns, answer your questions, help you through the process in any way that we can. So please do reach out to us with any needs that you have. I promise we're really friendly and we want to help you. I think pause again to see if my plea for questions resulted in any more.
This is Al Klein. I do have actually one question I thought of. So on the data you guys sent out, tables, there are some areas that are yellowed, or some indicators that are yellowed and said they're optional, and others that are not yellowed out and don't say optional, but there's no data in them. So is the expectation that we're going to find that data?
There's some pieces of data that we are still waiting to receive. Some things were a little bit more complicated to get because they had to be pulled by a variety of different people from different sorts of sources. So our expectation is not that you go pull the data, but if we can get together to send to you, we hope that you will include it in the process. That's a really good question. Yeah, thank you.
seeing questions or hearing questions right now, so I have a question for all of you. You know, we heard from the Nurse Administrators Forum that you had these concerns, and we were hoping that this question and answer webinar answered those concerns. Is there anything that we missed? Did we cover what you needed us to cover? I make sure we're meeting your needs. Does this question and answer help meet those needs?
Andrea Tabor from Mid-Michigan, and this has been very helpful for me, so thank you very much for the information. We appreciate it.
Oh, yeah. Thank you, Andrea.
Regina from Ingham County. I think it has been helpful. I think right now we just need to take a lot of it and digest it and have an opportunity to review the additional forms that we haven't seen yet. Absolutely, it was helpful.
Good. Thank you, Rena.
So next steps, again, completed steps 4 and 5, we're asking you to try to submit them by June 23rd. Let us know if you need a different deadline or an extension. And also we welcome earlier draft versions, and we'd be happy to work back and forth with you on any questions, any concerns, anything that comes up during the process. The submissions, again, can come to Lauren. And our next webinar on April 26th at noon to 2 o'clock, we will go over the maternal and child health system assessment as the final of the 3 assessments that we'll be covering. And with that, again, please reach out to us with any questions or concerns. We're more than happy to support you through this process. And thank you very much for being on the call today. We really appreciate it.
So, I will set an Outlook appointment for that April 20th meeting shortly when I get back to the office, or probably tomorrow.
Thank you, and have a good afternoon.
Thanks.